Welcome to Game Changers Silicon Valley, a show about today's emerging innovations that may be the game changers of tomorrow. My name is Jim Connor. I will be your host. The first segment of tonight's show will address healthcare technology. Healthcare is undergoing political, technical, and social disruption. How we evolve and integrate these changes into the healthcare system is a broad and complex issue. I have two guests here tonight to discuss the consumer side issues in providing choice of treatment and cost control management. My guests are Don Ross of Health Tech Capital, an early stage angel investor group, and Leah Sparks, founder and CEO of Wildflower Health. Don and Leah, welcome to the show. Don, I'd like to ask you to give us an overview of what's going on in healthcare today.
Sure. Well, thank you, Jim. So I appreciate being here. And really one of the big things that's going on in healthcare today is data, and really in big data analytics, and that is really driving a lot of both policies and what we can do in healthcare. And in particular, it starts to come down to being where you can personalize healthcare. And really the fundamental issue there is that it has to be actionable. And so I steal shamelessly from my brother, who is a 30-year veteran at IBM, that it's really, you can have too much data but not enough information, and you must have information that you can act upon. And of course, what this is really all about is changing behaviors, because that's really where the drivers of health and costs and chronic conditions come from.
And Leah, you have a company now that's addressing primarily the prenatal care and care for pregnant women. Is that correct?
That's right. Go
ahead and tell us about that.
Sure. Our company is called Wildflower Health, and we're a mobile health company that really is designed to help families tap into the healthcare system right on their smartphone or tablet. Our flagship program called Due Date Plus is a smartphone-based maternity management program that's delivered actually through the healthcare system, through insurance companies, through self-insured employers, through provider systems, to help women not just get tools on their mobile phone to stay healthy during pregnancy, but actually take action in the healthcare system.
I see. And does this include devices connected to the tablet or the cell phone, or is that a future?
Actually, we are rolling out now, actually for some very innovative clients here in Silicon Valley, some employers who actually offer their beneficiaries things like wireless scales and other fitness devices that we can actually link into our application so that our users can get wireless information. Like, for example, for pregnant women, weight gain is a really important health factor, one of those modifiable risk factors. And so if you can get that information wirelessly right into your phone and getting alerts if you're in or out of range, that really helps women stay on track with something like that.
And Don, your group is essentially finding and funding these early innovative technologies. And you mentioned the big data before, and the devices do collect big data. They collect a lot of data for that matter. It's a question of how to use that data to be, effective in the overall administration of healthcare?
Absolutely, and just in terms of looking at the wearables and that, is that they can have huge data streams, but then is what you do with it, and what good is that? And so that's where it really comes down to, and what Wildflower is doing there, and with the wireless scales, and that you're really solving a problem, and that it's a solution. Technology in and of itself really is an enabler. And at the end of the day, what we really need to do is solve problems and solve healthcare problems. And that's one of the reasons why we invested in Wildflower Health, because we're really impressed with what they're doing.
So you mentioned earlier in the conversation, you started the company when you were pregnant. Was that kind of where you had the insight or the recognition that, wait a minute, there's so much going on in my body right now, I need to be able to communicate with the doctor, let them know what's going on with me, and to just request an appointment or whatever it might be. Is that how this came about?
Yeah, in part. So I've been in the healthcare system for about 13, 14 years, working for big companies and also startup companies. And the challenge we always have in the healthcare system is getting people to engage, to make better decisions, to use the healthcare system appropriately. And I realize that when people start families, it's often the first time they deal with the healthcare system. They're very impressionable. It's a great time to sort of train them on how to use the healthcare system. And it just struck me as the perfect time to, one, engage people because they're sort of ripe for that. And two, I learned both through my own experience and my research that pregnancy is actually the #1 driver of hospital costs. So it's a huge cost area that we can address better as a system by helping to identify the people who have the highest risk for those costly pregnancy complications and getting the support they need in context, doing things with their doctor, tapping nurses that are available for free to them through their health plan, things like that.
So it sounds like the insurance companies and care providers must be happy to have this application? Is that something they're
Well,
welcoming?
that's definitely part of our business model. Our
Yeah.
clients are health insurance companies and typically people who go at risk and pay for health care, which now can be either providers or payers. And yes, certainly one of the challenges they have is both engaging families when they're expecting to help them make better decisions, and also finding those highest risk people to get them the support and interventions they need.
It is only on a mobile device, correct? And if a woman goes in who's pregnant, so and it's under the insurance company's administration, goes into the care provider, the care provider says, oh, we have an application we're going to put on your cell phone that will allow you to communicate with us seamlessly almost at any time, any place. Is that the exact way that this works?
In spirit, yes.
Yeah.
I mean, we are distributed through a variety of channels, everything from health plans to we're in some doctor's offices with some of our clients. And every instance of our application is always configured for the clients. And it's configured to reflect the resources available to you. So whether it's within one of our Medicaid clients where you're getting it from the state and their unique state resources, or a commercial health plan where they're unique health plan tools and resources, the tools presented to you in each version of our program is based on what is under your health benefits available through your local providers. So you can, whether it's clicking or to chat or call with nurses or use other tools, that's how it works basically.
So Don, this seems like the first step in a wave of mobile device technology connecting doctors with remote patients or patients with remote doctors. I think you're involved in this area and pursuing more in this area of telemedicine, is that correct?
Sure. So, and we're really involved in everything across the whole spectrum of the health tech space. And so it really is technologies in healthcare. And if I might make a comment just quickly on Wildflower Health before telemedicine, is that one of the things that we really like about Wildflower is that there's a challenge right now that as the system starts to move from fee for service to pay for performance, that you really have to have a business model that's going to work in both worlds, because you have today's world where you need to be successful, but that world is changing. So you also need to be able to change and evolve with that as our healthcare and the healthcare economics are changing. And that also, telemedicine really reflects that as well, that the cost advantages are so great in telemedicine that it's a technology that's been around for probably 10 years, but it's really hit a tipping point now, just because of the cost efficiencies that go along with it. And so now it's really, I think, really poised to become widespread.
How does telemedicine really work? Because I have an image, but I don't have the exact methodology.
So, for instance, Anthem Blue Cross and Live Health Online and UCLA have just all teamed up together to where it really is UCLA physicians available 24/7. And so you actually have, instead of going in to have an office visit, you actually have a virtual office visit via like a video conferencing technology.
And do I use my cell phone or tablet?
You can use, depending upon the system, you use your cell phone, you can use your tablet, you can use your PC or Mac. It really accommodates all different kinds of technologies.
But I do assume it's a face-to-face process.
It is a face-to-face process in terms of, you can get into definitions. So for virtual interactions, one of the things that's interesting is with Kaiser in 2015 has predicted that they will have more virtual interactions, which includes email, than they will face-to-face interactions.
Leah, you came from the healthcare industry, correct? And tell us a little bit about, you were in a company before. What led you to actually make the decision to found or start this company?
Well, I think I simply saw the pain point. I did not have a preconceived notion on the technology solution. I'm embarrassed to admit that when we started the company 2 years ago, I thought this would be a web-based solution. And as soon as we started talking to young pregnant women, we learned that their preferred choice now is all mobile, smartphone and tablets. If they said, if I leave my doctor's appointment and something has come up, my phone is always with me, that's where I'm going to go.
Do you think we might get to the point that when a woman is pregnant, goes to the doctor says, what's your smartphone, what's your phone number, cell phone? And if she doesn't have one, they go, well, here, you're going to use this one during this period of time because it's so valuable and so essential to have this service in place. We will loan you a phone. I
think it's going to be here before you know it. In fact, in some of our Medicaid clients in other parts of the country, we're already seeing free distribution of various types of mobile phones, or we even expect smartphones to be distributed for free so that people have those. They're such a great utility for the healthcare system.
Yeah. So Don, as your team goes back and looks at additional technologies and companies, Do you try to build now upon, in your investment business, build upon that strategy with adjacent companies?
So we're really open to good investment opportunities. And, that said, what we really look for is business models, or it can be a real challenge in this space. And that's one of the things that we really like about with Wildflower Health is the business model of working through with the insurance companies and the self-insured employers. And the one thing in terms of that, so yes, we will build off of it, but also we try to be really careful too, because we could do a company that right now may be synergistic, but down the road, if it's too close, they could end up to be competitors, and that's not something that we want to have in our portfolio, is be investing in two competing companies. We really like to have one in one space.
And what attracted you to this company, Wildflower?
Strong management team, strong CEO. I mean, that kind of background. The initial traction and data and some proof points that this was really going to work. There's a lot of arm waving, but actually having some solid data really makes a huge difference. The business model was really impressive. And so that really came together to where we thought that this was going to be a successful company.
The process of you raising money, early stage money, what was that like for you?
I think one of the things I learned being in healthcare is that there's a lot of wonderful investment opportunities in Silicon Valley, particularly in the technology segment. Healthcare is a different animal. And it was really important to us to have, particularly given that we are a B2B business model, working with clients that are large and bureaucratic and don't move that fast, to have investors who understand that and can appreciate that and understand the nuance and complexities of the healthcare system, which is why Health Tech Capital was such a great fit, and our other investors are also very healthcare savvy.
If you were to advise an entrepreneur in the health tech space, healthcare space, about coming into the marketplace, knowing what you know now, maybe an area adjacent, somewhere adjacent to you, what would you tell them to do or consider?
I would say keep in mind that healthcare is almost a $3 trillion industry, so pick something big. I liked maternity because it's $100 billion of hospital costs, and we will grow into other conditions, but start with something big because you can't do anything subscale in an industry this big. And two, I would say be pragmatic, be visionary and pragmatic at the same time, because you are dealing with a big beast, you're dealing with a lot of incumbents, and yes, it's so fulfilling to make a difference in the healthcare system, but choose your battles and figure out how to almost sneak into the system to drive change within.
What should we look for in the next 12 months from Wildflower?
Well, we're going to be continuing to extend our platform capabilities, integrating with devices and wearables, and we'll also be extending along the family health life cycle and launching a new product that supports families with pediatrics and other family health areas.
So once you have one a person in the family on, it's a high probability that you can extend that service to other members of the family within the same insurance company, obviously.
That's right. And we actually think that family health is this natural engagement cycle. Almost every decision we make in healthcare is informed in some way by the people that we love or care about, and our family, whoever we define as family. And we think that's a really powerful way to motivate people to make better decisions.
Don Ross, I want to thank you for coming here from Health Tech Capital. Leah Sparks from Wildflower, thank you for your time. Very much enjoyed meeting you, learning about your application and what it's doing for women in particular in our healthcare system.
Thank you.